Autism spectrum disorder is a mental health disorder that affects 1 in 500 people across the country. But what is autism spectrum disorder and how does it affect a person? Almost all humans have the same general developmental milestones and learn the same set of skills in nearly the same amount of time. By milestones, we mean learning the language, communication, socializing, cognitive skills, physical skills like crawling, walking, motor skills. All of these combined are indicators of brain's development. Although, in case one of these fails to develop in the expected time period, it could just indicate a possible neurodevelopmental disorder, especially if skills like socializing and communication don't proceed as normal. It can result in isolation. Before 2013, the Diagnostic and Statistical Manual for Mental Disorders, 4th edition or the DSM-4, described autism as one of the several pervasive developmental disorders, short PDDs, which included autism, Asperger syndrome, childhood disintegrative disorder, and not otherwise specified, also known as PDD-NOS. However, researchers found that the diagnosis of these pervasive developmental disorders were not consistent across different hospitals and clinics. There were no fixed signs or patterns that could be observed, since the symptoms were similar, yet differed some degree in each case. So the new DSM-5 removed these terms and replaced them with autism spectrum disorder, or shortly called ASD. There are 4 subcategories that clinicians look for to identify deficits in a child with autism spectrum disorder. The first one is social reciprocity. This refers to how a child responds or reciprocates in social interactions. Joint attention. Non-verbal communication. This refers to a child who finds it difficult to express gestures via non-verbal communication or is unable to perceive a similar nature of communication. Social relationships. This is when children face trouble in developing and maintaining relationship. So maybe the child might have a hard time making friends. Some further characteristics of autism spectrum disorder include lining up toys in a ritualistic manner, flapping one's hands, imitating words or phrases, being fixed on certain routines like taking the same route to the school, unusually fixating patterns of interest. Children with autism spectrum disorder might exhibit one or more of these deficits and vary in how severe the deficit is. Keeping that in mind, it is important to know that each child with ASD is going to have a different spectrum of symptoms and deficits. Treatment for autism. Since the behavior and challenges differ from one individual with autism to other, there is no permanent cure for the condition. There can be only treatment and counseling methods, specifically and carefully tailored for the autistic individual based on the severity and deficits, which include things like specialized education programs and behavior therapy, communication therapy, educational therapy, family therapy, speech therapy, occupational therapy. An early diagnosis and starting with treatments at a fairly early stage can tremendously help in the child's positive development. Autism spectrum disorder help for parents and children is available at CADBUMS. Reach out to us today.